Did you know you do not have to cut out carbohydrates to fix your blood sugar? In fact, one of the fastest ways to improve your numbers is actually about adding foods, not eliminating entire food groups like carbs. People who turn their numbers around often do it by adding specific foods to what they're already eating and keeping their sugar steadier for months and even years, not just for a few days. So in this video, I'm going to walk you through 10 foods you can use to support your body's own blood sugar regulation and insulin sensitivity, so you can bring your numbers down in a way that's natural and, most importantly, sustainable. Before we get into the first one, if you want more videos that explain the why behind your body instead of just a quick fix, hit subscribe, give us a like, and leave a comment telling me what your morning fasting number was this week. I read every one, and it genuinely shapes what we cover next. So let's get into it. Here's something that often gets skipped in a short office visit. High blood sugar usually starts upstream with a hormone called insulin. Insulin is a hormone that unlocks your cells, so glucose, the sugar in your blood, can get out of your bloodstream and into the cell where it belongs. When your blood sugar has spent years riding a roller coaster, your cells can stop responding as well. Insulin knocks, and the cell is slow to open the door. We call that insulin resistance. Your pancreas pumps out more insulin to compensate, and your blood sugar can climb anyway. Welcome to Human Health Zone, the channel built around understanding what's actually happening inside your body. And if that's useful to you, hit like and subscribe. It genuinely helps. And before we continue, I want you to know something. Human Health Zone exists purely as a fan channel, built to give credit where it's due. And the way of thinking about food talking directly to your insulin receptors that runs through this whole video comes from the teaching of Dr. Berg, DC, whose approach to looking at blood sugar as a whole body conversation rather than a single number is the foundation of everything you're about to hear. And there's a detail about Donna, a real patient story I'll share near the end of this video, that I want you to keep in the back of your mind. Because once you see the full list of 10 foods, you'll understand exactly how her numbers changed the way they did. Every one of these 10 foods does one of 3 jobs. It slows the sugar coming in. It cools the inflammation that keeps your cells less responsive to insulin, or it helps wake the insulin receptor back up so your body can do the work it's designed to do. You do not have to add all 10 tomorrow. Stack them in gradually over the next couple of weeks. This video is for educational and informational purposes only and isn't a substitute for personalized medical advice. So please talk to your own doctor before making significant changes, especially if you're managing diabetes or taking blood sugar medication, which we'll come back to specifically near the end. Let's start with the first one. Food number 1 is fenugreek seeds, small, hard, amber-colored seeds you can find in the spice aisle of almost any grocery store for a couple of dollars. If you walk past this one because it sounds unfamiliar, you're skipping one of the more useful blood sugar tools on the shelf, and it costs less than a coffee. Here's what it does. Fenugreek is packed with soluble fiber called galactomannan, and when it hits water in your stomach, it swells into a thick gel that physically slows how fast carbohydrates move into your small intestine. Slower emptying means the sugar trickles into your blood instead of flooding it, so there's less of a spike and less of a sudden insulin surge in response. Fenugreek also contains an amino acid that may help your pancreas release insulin more efficiently and support your muscle cells in taking up glucose. To use it, take 1 teaspoon of whole seeds and soak them in a glass of water overnight. Then in the morning, drink the water and eat the softened seeds before breakfast. If the slightly bitter taste is too much, grind them and stir half a teaspoon into yogurt or sprinkle it over eggs. Start low, since this fiber is strong, and your gut may need a few days to adjust. Food number 2 is cinnamon, and you likely already have it in your cupboard, but the type matters more than you'd think. The common grocery cinnamon is cassia, and it carries a compound called coumarin that can be hard on the liver in large daily doses over time. The one I'd recommend for everyday use is Ceylon cinnamon, sometimes labeled true cinnamon, since it's milder and considerably lower in coumarin, making it safer for daily, ongoing use. Now, I want to be precise about the research here. Cinnamon's effects on blood sugar come from a group of polyphenol, plant compounds that may help your insulin receptors bind glucose more effectively and slow stomach emptying after meal. A well-known study from the USDA's Beltsville Human Nutrition Research Center found that around half a teaspoon of cinnamon daily meaningfully improved fasting glucose in adults with type 2 diabetes, though that particular research was conducted using cassia cinnamon specifically, not Ceylon. The broader research on cinnamon and blood sugar is genuinely mixed. Some trials show a real benefit and others show none at all. So think of it as a reasonable, low-risk thing to try rather than a guaranteed fix. If you do try it, use Ceylon for daily safety, about a quarter to a half teaspoon a day, stirred into oatmeal, coffee, or smoothie, ideally alongside a carbohydrate-containing meal. Third on the list is broccoli sprouts, and I want to pay attention here because the distinction matters more than with any other food on this list. Not full-grown broccoli, the young 3-day-old sprouts specifically. Broccoli sprouts are loaded with a compound called sulforaphane, and sprouts contain far more of it, by some estimates 50 to 100 times more, than a head of mature broccoli. Sulforaphane is interesting because it appears to act on your liver's overnight glucose production specifically. Your liver makes sugar while you sleep, and in insulin resistance it can make too much, which is part why some people wake up with a high fasting number they can't otherwise explain. A well-designed 2017 study from researchers at Lund University and the University of Gothenburg in Sweden gave a concentrated broccoli sprout extract supplement, not raw sprouts eaten as food, to adults with type 2 diabetes over 12 weeks, and it measurably reduced fasting blood glucose, with the strongest effect specifically in obese patients whose blood sugar was hardest to control. I want to be honest that this was a concentrated supplement dose, not a casual handful of sprouts on a sandwich. So think of eating raw sprouts as a reasonable, low-risk addition to your diet on its own nutritional merits, rather than something proven to replicate that exact clinical result. You can grow broccoli sprouts on your own counter in a jar for pennies, or buy them in the produce section. A small handful, about a quarter cup, on a salad or sandwich most days is a sensible amount, and it's best eaten raw or barely wilted, since high heat destroys the active compound. So far, every food has done similar quiet work, slowing sugar down or supporting the receptor, and we're only 3 in. The next few are foods that change the meals you're already eating. If someone in your life is working on their numbers too, this is a good video to send them, since this is the kind of explanation that often doesn't come up in a quick appointment. Number 4 is avocado. Many people think of it as a fat to avoid because of the calories, and that worry can cost them a genuinely useful tool. The fat in an avocado is monounsaturated, the same family as olive oil, and it's one of the more blood sugar-friendly things you can put on a plate. The reason is straightforward. The healthy fat and fiber inside an avocado slow your whole meal down. When you add half an avocado to a plate of rice or toast, you're not removing the carbohydrate. You're putting a gentle brake on how quickly it turns into blood sugar, so the glucose rises more gradually instead of spiking. Over time, monounsaturated fat has also been associated with improved insulin sensitivity, meaning your cells may respond to insulin's signal a bit more readily. Half an avocado a day is a sensible amount, on eggs in the morning, mashed onto whole grain toast, or added to a salad that already has a starch in it. Anywhere there's a carbohydrate, an avocado can soften the impact. Number 5 is chia seeds, tiny gray and black seeds that punch well above their size. If you've ever seen chia sit in liquid and turn into a pudding, you've already seen how it behaves in your gut. Chia is one of the richest sources of soluble fiber available, and when it meets water in your stomach, it forms the same kind of thick gel we talk about with fenugreek, wrapping around the carbohydrates in a meal and slowing their absorption. The sugar releases more slowly and steadily, helping you avoid the spike and crash that can leave you shaky and hungry an hour later. Chia also carries a plant-based omega-3 fat that may help calm the low-grade inflammation that sits underneath insulin resistance. 1 to 2 tablespoons a day does the job. Stirred into yogurt, dropped into a glass of water with a squeeze of lemon, or blended into a smoothie. Give it about 10 minutes to gel before drinking it, and drink plenty of water alongside it, since that fiber needs liquid to move through your system comfortably. Number 6 is fatty fish, specifically salmon and mackerel. This one works a little differently. It targets the deeper reason your cells became less responsive to insulin in the first place. Insulin resistance is driven in part by chronic, low-grade inflammation, And when your body stays quietly inflamed year after year, that inflammation can interfere with the insulin signal at the surface of the cell. Salmon and mackerel are rich in 2 omega-3 fats, EPA and DHA, among the more well-studied natural anti-inflammatory compounds we know of. They may help lower inflammatory signals, support a healthier cell membrane, and help the insulin receptor function more the way it's meant to. Aim for 2 servings a week, about the size of your palm each. Wild salmon, mackerel, sardines, and herring are all good choices, baked, grilled, or canned if that's easier on your budget. Canned mackerel and sardines are some of the most affordable, nutrient-dense options on this entire list. 7th is walnuts. Of all the nuts, this is one worth prioritizing, both for the lining of your blood vessels and for insulin sensitivity. Walnuts are rich in polyunsaturated fat, and the same plant-based omega-3 found in chia. That fat supports the function of your endothelium, the thin lining inside your blood vessels, which is one of the things high blood sugar can damage over time. At the same time, the fat, fiber, and protein in walnuts can blunt the rise in blood sugar after a meal and have been associated with lower fasting insulin, the number underneath your blood sugar that reflects how hard your pancreas is working. Eat a small handful as a snack instead of crackers or a cookie, and you turn a sugar spike into something closer to a flat line. A small handful is about a quarter cup, or 7 to 10 whole walnuts, kept raw or dry roasted rather than candied or honey-coated, and used to replace a processed snack rather than added on top of one. Number 8 is eggs, whole eggs, yolk included. For years, many people were told the yolk was something to avoid, and that advice sometimes pushed people towards sugary breakfast cereals that were genuinely worse for their blood sugar. A whole egg is almost entirely protein and fat with virtually no carbohydrate. So on its own, it barely moves your blood sugar at all. The real benefit shows up in what's sometimes called the second meal effect. When you start your day with eggs instead of toast or cereal, your blood sugar tends to stay steadier not just at breakfast, but through to lunch. So you walk into your next meal with calmer numbers and a smaller spike. The protein and fat also help keep you full, so mid-morning cravings tend to ease up too. 2 or 3 whole eggs in the morning is a solid target for most people, scrambled, boiled ahead for the week, or folded in with some spinach, and adding that avocado from earlier right on top builds a genuinely well-rounded blood sugar-friendly breakfast. Number 9 is apple cider vinegar, and this is the one with some of the fastest visible effects if you track your numbers at home with a meter. The active ingredient is acetic acid, and it does 2 things. It slows how quickly your stomach empties, so the carbohydrates in a meal arrive in your bloodstream more gradually, and it appears to help your muscles pull glucose out of your blood and use it for fuel. The research here is genuinely solid. Work led by Dr. Carol Johnson at Arizona State University has repeatedly shown that a tablespoon of vinegar before a carbohydrate containing meal measurably reduces the after-meal blood sugar spike, with some of her studies showing improvements in insulin sensitivity of 20% or more in people with insulin resistance or prediabetes specifically. That a meaningful effect from something that costs a few dollars a bottle. Take 1 tablespoon, and this matters, dilute it in a full glass of water, 10 to 15 minutes before a meal that contains carbohydrates. Always dilute it. Never drink it straight, since the acid can be hard on tooth enamel and your throat. And if you already take medication for blood sugar, talk to your doctor first, because vinegar combined with that medication can lower your sugar faster than you might expect. The 10th food is lentils, and this one proves the whole point of this video. Lentils are a carbohydrate, and they can still help lower your blood sugar. Here's how. Lentils are built from a slow-digesting resistant starch, wrapped in soluble fiber and a healthy dose of plant protein, so the glucose inside is released into your blood slowly and steadily over hours instead of all at once. They carry that same second meal effect too, so a bowl of lentil soup at lunch can mean steadier sugar into the evening. Swapping white rice or white potato for lentils a few times a week is one of the more reliable, well-supported ways to support a healthier A1C over time, your 3-month average blood sugar. Aim for half a cup to a cup of cooked lentils a few times a week, in a soup, a stew, or a cold salad with olive oil and a splash of the vinegar we just covered. They're filling, inexpensive, and stretch a meal further than almost anything else on this list. Let me tell you about someone I'll call Donna, 63, recently retired, who came in frightened because her fasting sugar was sitting around 180, and her doctor had just told her it was time to add a second medication. She didn't want to keep climbing the medication ladder, and she was scared, having watched her own mother lose her vision to complications from the same disease. We didn't cut her carbohydrates to nothing. We added eggs and avocado in the morning instead of cereal, a tablespoon of vinegar before her bigger meals, lentils swapped in for white rice, walnuts instead of an afternoon cookie, fatty fish twice a week, cinnamon in her coffee, and broccoli sprouts on her sandwich at lunch. Within the first week, her fasting numbers started dropping, and within 3 months, working closely alongside her own doctor, she came down off that second medication entirely, with her A1C moving from the diabetic range back toward normal. 2 years later, it's held. She didn't starve herself. She ate more food, just different food, and her own body did the rest of the work. So let's tie all 10 of these together, because this is the reason they can work even when cutting carbs alone doesn't. The fiber foods slow glucose down, so your pancreas doesn't have to work as hard all at once. The fish, walnuts, and chia help calm the inflammation that was interfering with the signal. The cinnamon and vinegar work more directly on helping the insulin receptor respond. Do that meal after meal, day after day, and a cell that had become less responsive can gradually start answering the door more readily again. And once it starts happening, your body can hold your sugar down more on its own, which is part of why Donna's numbers held for 2 full years. Before I give you tonight's plan, I need to draw one clear line. If you're on insulin or sulfonylurea, one of the older blood sugar medications, these foods can lower your sugar fast enough that your medication dose may suddenly be too high for your new numbers, and that can drop you into a low blood sugar episode. So add these foods with your doctor watching your numbers, and let them adjust your medication dose as your body improves. Do not stop any prescription on your own. Bring this list to your next appointment instead. Here's what to do tonight. 5 simple steps. 1. Tomorrow morning, replace cereal or toast with 2 or 3 whole eggs and half an avocado. 2. Tonight, soak a teaspoon of fenugreek seeds in a glass of water and drink it first thing in the morning. 3. Buy Ceylon cinnamon, not cassia, and start with a 1/4 teaspoon a day in your coffee or oatmeal. 4. Before your biggest carbohydrate meal tomorrow, take 1 tablespoon of apple cider vinegar in a full glass of water 15 minutes ahead. 5. This week, swap white rice or white potato for lentils at least twice, and put fatty fish on the menu 2 nights. Stack these and over the next 2 weeks. You're not removing the foods you love. You're adding the foods that support you. If you got value from this, hit like on this video, subscribe to Human Health Zone, and let me know in the comments which city or country you're watching from tonight. I genuinely love seeing how far this reaches.